Since screening is such an integral part of the success of PrEP as a prevention intervention, we'll provide an example of a doctor screening a patient to determine his appropriateness for PrEP. Meet Matteo. Matteo is a 28-year-old gay man who has come into his local health center to get HIV and STD tests. He meets with Dr. Howard.
Hello, I'm Dr. Howard.
Hey, Dr. Howard. I'm Matteo.
Nice to meet you. So how are you feeling?
I'm feeling great, thanks.
That's good to hear. So what brings you in to see me today?
I'm here to get an HIV test and also to get tested for other STDs.
Okay, well that's something we can do today. What made you decide to come in to get tested for HIV?
Well, I use condoms most of the times when I'm having sex with people, but not every time. It's been hard. Last year I was on PEP a couple of times when I slipped up. I just want to make sure I'm okay now.
So it sounds like you use condoms sometimes when you're having sex, but find it challenging to use them every time. When you have sex, is it anal sex? Are you the top or the bottom?
It was anal sex and I'm a bottom. I know I should always use a condom, but it's just not that easy.
Well, there are other options. You know what PEP is, but have you heard of PrEP or pre-exposure prophylaxis?
No, what is that?
PrEP, similar to PEP, is another way to keep from getting HIV. It involves taking a pill called TRUVADA, which is the combination of two drugs that are commonly used to treat HIV in persons who are HIV positive. When taken daily by people who are HIV negative, it can block HIV from infecting the body. The pill has to be taken every day for it to work effectively, just like PEP. Unlike PEP, PrEP is not just a 28-day treatment after having sex without a condom, but something you take every day to work as a chemical barrier if you decide to take a risk. What do you think about that?
Well, I take a multivitamin every day, so I'm sure I could do it. And I do want to take good care of myself. So just the pill will keep me free of HIV?
No. You should still use a condom as much as possible. It's not replacing that, and it won't prevent STDs. Well, before we get started, we should first test you for HIV and make sure you're still HIV negative. And I'd also like to conduct some other tests to make sure there won't be any major problems with PrEP. Is that okay with you?
Sure.
This exchange demonstrates an example of a doctor identifying a candidate for PrEP and providing some education about the medication. Now, we'll revisit Matteo and Dr. Howard to see an example of a doctor conducting the pre-prescription assessment with the patient.
So I need to ask you some questions to make sure that PrEP is all right for you. Is that okay?
Sure.
Have you had any flu-like symptoms, such as body ache or fever in the last 6 weeks?
No, I've been feeling great.
Have you had a rash, sore throat, or swollen glands?
Nothing like that.
What medications do you take daily?
I take a multivitamin and an allergy medication.
Okay. In the last year, was there a period of time where you felt sad or depressed for more than 2 weeks in a row?
No.
In the last year, was there a period of time lasting more than a month where you felt worried or anxious?
No.
How often do you drink alcohol?
Well, I drink with friends in the weekends.
Okay. Do you use any other drugs?
Just pot, and sometimes I take ecstasy and acid, but that's just not often.
Thanks for sharing. In the last year, did you ever drink or use drugs more than you intended?
Nope.
Okay. Have you ever felt that you wanted or needed to cut down on your drinking or alcohol use?
No, I don't think I have a problem with drinking or drugs.
Okay, that's good to hear. So what's your living situation? Do you own or rent or live with family or friends?
I rent an apartment with a roommate.
What kind of health insurance do you have?
I have Medicaid. Is that a problem?
No, New York Medicaid covers PrEP, so everything's fine.
Oh, okay.
I need to ask you some questions about your sexual partners, and it may be kind of personal.
That's okay. I was ready to answer any questions for the HIV test.
Thanks for your openness. Do you know if any of your sexual partners have HIV?
Not that I know of, but I usually ask about HIV when I'm having sex with someone.
Okay. Final question. Do you have any regular sexual partners, like a boyfriend or friend with benefits?
Not right now.
Thanks for answering all my questions. What questions do you have for me?
The pills. Are there any side effects?
Excellent question. The side effects should be minimal. Maybe some headaches, abdominal pain, weight loss, but they should typically go away after a month or sooner.
This exchange shows how to conduct a pre-prescription assessment. It can be a lengthy process, but it's important to be thorough so as to anticipate any potential barriers to adherence. We will now revisit Dr. Howard and Matteo at the 3-month follow-up visit to see what PrEP monitoring can look like in action.
Hello, Mateo. How have you been?
I've been great, Dr. Howard. How have you been?
I've been well. Thanks for asking. How is prep going?
It's been going really good. The past 2 months have been great. No headaches.
Have you had any trouble taking your pill every day?
No. I missed a dose a couple of weeks ago when I was running late to work, but that's it.
Okay. I want to stress how really important it is that you take your pills every day. If you miss doses, it won't be as effective.
I understand.
Have you had sex with anyone since the last time I saw you?
A couple of people.
Did you use a condom?
I used a condom with one of them, but not the other.
Well, if you like, I can give you some condoms before you leave here today.
That'd be great.
Now, have you had any discharge from your penis or burning when you pee?
No, nothing like that.
Have you had any anal pain, discharge, or bleeding?
No?
Great. Well, I'd like to do another HIV test and a test for your kidneys, just to make sure everything is going okay. Is that all right?
Sure.
If your HIV test is negative, I can write you a prescription for a 90-day supply of PrEP, and we'll see each other again in 3 months. Of course, you know you can always call if anything comes up before then.